Hi, my name is Maya, and today I am going to be showing you how to start an IV. So I'm going to be doing this on my patient, Mr. Squish, and the first thing I'm going to do is confirm the physician's order, and I'm going to gather my supplies. So my supplies are going to be an IV start kit, extension tubing, a saline flush, and a 20 gauge catheter needle, and of course some gloves. So while I'm doing this, I'm going to make sure I'm maintaining standard precaution, and I'm going to make sure I've reviewed my policy and procedures for my facility about infection control. So now I am ready to go speak to my patient. So I'm going to wash my hands and introduce myself. So hi, my name is Maya. I'm going to be your student nurse today. Before we get started, can I verify your name and your date of birth? Great. And Mr. Squish, do you have any kind of allergies? No, so no latex, no tape, no adhesive, anything like that? Awesome. So today, I should be in here for about 10 to 15 minutes. We're going to be starting an IV. I'm going to explain everything while I'm going, and if you have any questions, please let me know. Okay? Great. So now I'm going to put the bed up, Mr. Squish's bed, up to a comfortable level, and I'm just going to ensure that he's comfortable before we get started. Now I'm actually going to be assessing my venipuncture location. So I'm going to make sure to use Mr. Squish's non-dominant arm. I'm going to be looking for veins that are relatively straight, and I'm also going to make sure I've reviewed my policy and procedures towards shaving the site. Now I'm going to put a sheet protector underneath Mr. Squish's arm just to protect the sheet, and we're ready to find a vein. So I've got my tourniquet here, and I'm going to tie it on my leg just to show you how I would tie it on Mr. Squish's arm. Pull it taut. And there we go. Can you see that? There we go. And here's a quick release. Awesome. So I'm going to tie the tourniquet on Mr. Squish's arm. And if Mr. Squish was an older adult, I would make sure to tie it on his shirt. That way we're not dealing with any kind of skin integrity issues. So I'm going to explain to him that this is going to be a little tight, and I'm going to tie it on. And next I'm going to be looking for my veins. So I'm going to be feeling for veins that are nice and bouncy, and I'm also going to, if I don't see any veins, then I'm going to encourage Mr. Squish to pump his arm, and I'm going to be massaging those veins in the venous return direction. So Mr. Squish has great veins, lucky me, but if he didn't, if I did all those steps and I still don't see any veins, I would release the tourniquet, I would wrap Mr. Squish's arm in a moist, warm towel, and for about 10 to 15 minutes, and I would try again. So now I'm going to take the tourniquet off Mr. Squish so we don't kill his arm, and we are going to go ahead and get all of our supplies ready. So I'm going to wash my hands again, and I'm going to go ahead and put on my gloves. So after I've put on my gloves, I'm going to go ahead and flush my extension tubing. So I've got my saline flush. I'm going to get the bubble out by pulling back on the plunger. And we're going to screw it on the extension tubing. Nice and tight. And we're going to flush it, get all the air out, and it's dripping. So now I'm just going to put this back in my container packaging just to make sure it stays clean. So after I've done my flushing, I'm going to tie the tourniquet back on to Mr. Squish, and we're going to go ahead and clean the site. So in my IV starter kit, I have a nice chlorhexidine wipe, and we're going to use this, and I'm going to come in and go in a circle from the inside to the out, and I'm going to allow that to completely dry. So after it's dry, we're ready to start the insertion process. So as I said, I have a 20 gauge needle, and the needle size would depend on the vein I find and what exactly I'm infusing. So 20 gauge is good for what we need. So I'm going to go ahead and get out my needle. And we're going to take the top off very carefully. Can you come a little closer so you can see this? Like, I need you to come up here so you can see this. So now that I have my needle, I'm going to make sure to insert it bevel side up. And I'm just going to make sure I warn Mr. Squish before we insert it. I'm going to pull the skin taut. Okay, Mr. Squish, on 3. 1, 2, 3. I'm going to insert it into the vein. And once I start to see blood flashing back, I know that I'm in the vein. So I'm going to push it forward about 1/4 of an inch more. Just a little bit more. And so now that I've pushed it up, I'm going to go ahead, make sure that I'm keeping the needle steady. And I'm going to push up the hub. Okay, so now that I have the hub up, I'm going to, if I inserted this needle and I saw any kind of hematomas, I would make sure to release the tourniquet, release the needle, and start over again. So I'm going to release the tourniquet, and I'm going to go ahead, hold above proximal to the hub site, and we're going to engage the needle safety. So I've got the needle safety. I would put this in the sharps box now. So now I'm holding above the site just to make sure I'm not getting any blood flashing back on me. We're going to remove the top on the extension tubing. And we're going to screw it in, making sure it's nice and snug. Okay, there we go. And now I am going to go ahead and flush the site. And I'm not really going to do this because Mr. Squish likes to grow mold. But I'm going to go ahead and flush the site with the saline. And once I'm done with that, I'm going to unscrew it. And now we're ready to tape it down. So I have my Tegaderm and my IV extension kit. And Mr. Squish is kind of difficult to put tape on, but we're going to try. So I'm going to put the Tegaderm on over the IV site. And on here it has a place where I can put my initials, the date and the time, and the gauge of the needle. And I'm just doing this so the next nurse knows what's going on with this. And now I'm going to tape that extension tubing. I'm going to wrap it up and tape it, the extension tubing. So after I've done that, I'm going to take off my gloves. Well, I'm going to throw away, I've already thrown away all my trash. I'm going to take off my gloves. I'm going to wash my hands. And I'm going to do one more last safety check on Mr. Squish. So I'm going to ensure that the bed is lowered and locked, that he has his belongings near him, that he has the call light near him, that he has everything he needs before I leave that room. And that's it for insertion. Now I am going to go ahead and discontinue the IV catheter. So I'm going to once again review the doctor's order, and I'm going to ensure that I have all of my supplies. I've already done my ADIT. I'm going to wash my hands. I'm going to put on gloves. We're going to stop any kind of fluids going towards the IV, so we're going to discontinue that fluid. And now we're going to take off the adhesive tape. And I would take this off normally. So normally I would take this off. But I'm just going to take off the tape now. get stuck on my hand. I washed my hands and I already put on my gloves. Can't remember if I said that. And so now I'm just gonna have my gauze ready and I'm gonna take it out. So on 3, Mr. Squish, 1, 2, 3. And I'm just gonna ensure that the catheter is intact before I throw it away, and I'm gonna dispose of this properly. And then I'm gonna tie a piece of tape on the gauze and we're good to go. So after I've done that, I'm gonna document. So I'm just gonna make sure I put the name of the patient, the date, the time, my initials. I'm gonna make sure I'm saying how the patient responded to it. I'm gonna make sure to write how many attempts, the catheter, the type I use, the type of tape I use. I'm gonna make sure I've written down I'm documenting any kind of teaching I've given them. And yeah, I believe that's it. So thank you for watching.